Okay,
Yes.
we are good to go.
Okay.
All right, so
Okay.
today I'm going to introduce Dr. Yang. He is my guy. I always say I got to go see my
Mhm.
guy as we are
Hello. Yeah.
active and aging, and even when we're not aging, we can have injuries that occur. And not only do we have an opportunity to see somebody like you who can do a full body assessment and kind of just look at you and say, hey, this is what I think's going on. But you can also put the pieces of the puzzle together um, as to, hey, maybe it's you have so much stress going on in your life and
Mhm.
that's impacting your body, or your shoulder might be hurting you from the fact that you've been sitting like this, looking at your computer, and you're totally stressed. So you really are able to take a picture of a person and kind of put all the puzzle pieces together to help them feel better. So one of the things that was really intriguing to me was the first time I came to you and I had acupuncture. So can you talk a little bit about that? And I think really the goal of today is to really share what you do, the modalities that you use, and how they kind of work. Um, and why would somebody even come to see you in the first place versus go to their primary doctor? So I'll go ahead and let you introduce yourself first.
Okay. All right. Hello, guys. My name is Richard Yang. They call me Dr. Yang. So I am credentially in the field of Dr. Chiropractic and also Chinese medicine acupuncture. So I've been doing it for 20 years. So Michelle, it was nice of you to invite me here to talk about acupuncture and what I do. Thank you so much.
You're
This is my
welcome.
first time, so forgive me if I get a little nervous and kind of get little stutter. Please forgive me for that, but I will go into uh, how I practice and how my approach is. I've been doing this for 20 years. So I realize that there's a lot of patients that come to see me or other doctors. Sometimes it's very simple, but just because I don't think that other doctors educate the patient as well. So for me, it's like you mentioned it, Michelle. It's like when the moment the patient comes in, as a doctor, you already evaluate them, how their appearance, how they look, how their posture is. So from then, you are already determine what's going on. So you would just follow up some kind of questions to confirm that they do have those kind of problems. So let's say, for example, for you the other day, you come in, you say, oh my gosh, Dr. Ye, my shoulder is hurting this and that. And then my thing is looking at you, you're very calm. But the moment that I ask you a few questions, what you do, how's your day? You already told me your day. So I go, oh no, it's not just the rotator cuff we're talking about. I think it's probably the posterior, neck muscle, and the trap in levator is probably really tight too. So as you can see, from then on, then we could say, okay, maybe it's not just the shoulder rotator cuff itself, but it's also the traps and also the levators and posterior neck muscle as well. So that's why sometimes that because of the rotator cuff, it has its own function, also the traps and the elevators too. So sometimes when you talk about, oh, Dr. Yang, I can't lift my arm this, I can't do this, then we kind of determine because we understand what the muscles of the rotator cuff does, right? So then once you tell me the motions that you're in pain, then we kind of determine what's causing that. So from then on, we could do the proper diagnosing to find out exactly what muscle, what tendons that is the problem that inhibits or make you unable to have that range of motion. So from then on, we could determine that by doing orthopedic examination, just regular range of motions, and then we could do palpations. After palpations to determine exactly what muscle, tendon, whatever it is that caused that shoulder. Then from then on, the reason why we do acupunctures is to for example, still with the shoulder again. So we do acupuncture. We choose points to relax the muscles of the shoulder. Once that's done, then we could do um, cupping. You know, a lot of people now that are very familiar with cupping. So what we do is cupping is still our goal is to relax the muscles or to decrease the pain or inflammations of the shoulder. So what do we try to do a lot of modality. Our main purpose is to restore the range of motion and decrease pain. So therefore, it could be do acupuncture, cupping, ART, stretching, whichever that will help you resolve that problem. So that's the mainly of my practice here. So when you guys come in here, we don't just focus on one thing, but we want to find out exactly what's the problem of your problem. So from there on, then we can move forward with that.
Yeah, and I think we were talking about this the other day, and my content for this week is really talking about how pain may not be actually coming from the place that you think you're feeling it in, or that you are feeling it in. So yes, you might have pain in your glute, for example.
Mm-hmm.
That pain could be coming from an imbalance someplace. It could be coming from a different joint. It could be coming from a different muscle or tendon. So it's really identifying, okay, we know that you're having pain here, but is that really the source of the pain, or is there dysfunction elsewhere that's causing that pain? And that's one thing that I think you're really good at trying to decipher, because everything is tied together, right? We know our body
Right.
connected from our feet to
Mm-hmm.
our head, and
Correct.
in between all of that is your nervous system and
Mm-hmm.
all of the different interconnectivities that we have throughout our body. So it's like when one thing is affected, it's going to affect everything else. Eventually, it could,
Mm-hmm.
unless you address where that root cause or dysfunction or
Right.
imbalance might be. And I think that's what you're really awesome at.
Mm-hmm.
Can you explain a little bit about acupuncture and how that works?
Oh yeah, definitely. So acupuncture is in Western here. It just been introduced maybe like 100 years ago, but then acupuncture is well known in China in the Eastern countries over there. So acupuncture is been practiced by the Chinese practitioners for thousands of years. So basically, acupuncture we follow the philosophy theory of yin and yang. Everything needs to be balanced, and then the philosophy is that our body is made of all these meridians. So all these meridians are represented by our internal organs. So such as the heart, the lungs, the kidneys, the large intestine, the stomach. So each of these organs here, they have a meridians. So each of these meridians that interconnected through our bodies, they have points on there. So each of these points, they have their own functions. So let's say, for example, for someone with the lower back pain, so a lot of times for acupuncture perspective, we say, oh, since the kidney channel is running along the low back there, and there's also the urinary bladder channel is also running through the low back there. So therefore, it has to be low back pain. It could be due to trauma. It could be due to, deficiency, or it could be due to stagnations. Okay. So the way that we diagnose in acupuncture and how it works is that we don't diagnose how the Western diagnose the patients. So if we were to diagnose how the Western diagnose the patients, then we don't know what to do with the patients, right? So let's say, for example, someone went to play some football and they sprain their back, so they come in, they can't barely walk, and then from then on, we could determine, okay, this one is due to trauma. And then this one is related to the kidney channel, the urinary bladder channel. So there are points on those channels that treat for acute low back pain. So therefore, by doing that assessment, and we know, physically and observations that, and then by taking history, that the patient actually get injury from football. So
Mm.
therefore, sometimes it's acute like that. So we can't really touch the patient so much. So therefore, we have to choose those points that is, that goes through the low back. So in acupuncture, we the philosophy, we believe that maybe there might be a chi stagnations, okay, or blood stagnation. The channels that runs through the low back there might get stagnant as results of the injury. So therefore, we choose points to unblock those channels. So allow the energy flow and blood flow into that. So allow the healing process to enhance instead of just using ice and heat and so forth like that. So that's how one way of the acupuncture works. So it's by using the proper channels, proper points, and knowing exactly if it's acute or what's the cause of the injury. So from that, therefore, we could definitely really get a very good results from the acupuncture treatments, especially for like lower back.
Yeah. And I thought I remembered you telling me at one point that acupuncture will actually allow the white blood cells
Yes, correct.
to enable healing.
Yes, correct. So just for example, right? So that is in the perspective of the Western way of thinking, right?
Okay.
So before I was speaking to you is in the context of Eastern philosophy and theory. Okay.
I see.
So for
Okay.
me to talk for you to understand, that's kind of like you're kind of confused. So that's why, excuse me. So that's why I have to explain it in that way. Right. So just imagine our body has the ability to heal, right? We all know that.
Right.
Some people maybe don't think, but just remind them that our body has the ability to heal. So, what needs to increase the healing process? Let's say, for example, you cooked and you get burned, right?
Hmm.
And then over time, our immune system comes in place, right? So they know where you get burned. So that's where it sends to your brain, say, hey, something's going on in Michelle's hand. She got burned. So your body sends it. So they send all these white blood cells to that area. And they go, oh my gosh, there is something going on. Let's start fixing it, right? Yeah.
Okay.
So then, yeah, sometimes, when we get injured like that, uh, I would like to say that, yeah, our body sense that there's something going on. For example, from the low back again, right? So they know that there's some injury in the lower back, and that's why it's stiffed up. The reason why when you injure your low back is stiffed up is just that your body edges go into this automatic, protective mode to where so that you don't move anymore, so that you don't get more injury. So
Ah,
therefore, yeah, so therefore, all these white blood cell moves in there. Yeah, maybe 10 million goes in there and they say, okay, let's start fixing it. But then when you do acupuncture, when I start poking it in there, you stimulate your brain. Oh my God, there is more stuff that going on there. So therefore, instead of 10 million, now 100 millions is coming there. So
I
that's
see.
why that's in the perspective of Western, right?
Gotcha.
Yeah. So before you ask me about acupuncture, so I have to speak in terms of acupuncture because a lot of people would not understand the meridians and the points and unblock the chi and get the blood flow into there. So when you ask, when I talk to a Western educated patients, I usually use that analogy so that they have a better understanding.
I
Okay.
see.
And yeah, and I also use a lot of the 405 freeway. Okay. So it's kind of like the 405 freeway is the meridians right here to your house, in order for everything to function, you from your house and the 405 has to be functional. If one car accident is there, you coming to see me, the energy coming to see me, one car accident blocks the whole entire links, the whole entire road. So therefore, coming to me is harder, right? So therefore, you have to move that so unblock all the lanes. So therefore, they're clear. So it's easier for you to come get me to come and see me. So it takes less time, right?
Yeah.
So then to come and see me. So same thing, same concept with the acupuncture in the meridians. Sometimes some of the meridians get injured, or they have, you know, stagnation. That's what we call. So what we need to do, choose the points to open up the channel, so then when blood flow, chi flow, everything will heal faster.
Okay.
Okay.
Got it. Very similar to
Yeah.
reflexology.
Yes.
Yeah.
Very similar. Yes. But this theory has been going on for thousands of years, and it's proven uh, um, over the many years that it has been very effective treating pain, and also treating a lot of internal stuff. So maybe later on, if you want to talk about some internal stuff, we could go over some of that stuff too. Okay.
Yeah. How about red light therapy?
Well, the red light therapy, a lot of times the red light therapy, it's mainly used by dermatologists, right?
Really? Okay.
Yeah. So then, yeah, for smooth skin, and you know, supposed to kill some of the old cells and new cells do. But for us, for acupuncture doctor and Eastern medicine doctors, we use the red light, what we call infrared light. There is to help with the promote with the blood flow, and also promote with the, you know, regenerations of this muscle tissues. So that's what, and infrared has been shown on study that, you know, things grow under infrared but better than just the natural lights here. Yeah. So,
Okay.
and plus, yeah, a lot of times patient comes, they're cold, so there's also warm their feet too. Or keep them
That's true.
warm. Yeah,
That's
yeah,
true.
yeah, yeah.
All right. And last but not very least, you are
Mm-hmm.
very well versed in
Mm.
and I can share bruises.
Yeah. Well.
Little ones, just little ones. In active release therapy. Can
Hmm.
you talk a little bit about that?
Oh yeah,
What
definitely.
is it? What are the benefits? What are some of the techniques
Okay.
in order to do so? I've actually been wondering if I can go get certified in it. Not really for
Mm,
my not to use on anybody else, but more just
mm,
my knowledge.
mm. You know, when we were in the doctor programs and chiropractic, we usually takes, I don't know if they actually accepts anyone else other than professionals, you know, maybe if you're a professional trainer or something like that, or PT, I don't know. So you have
Yeah,
to go to their
I'll
website
have
to
to figure that
actually,
out.
yeah, but you know, it's very expensive. So the course that they teach is per region. So it's like maybe $1,500 per region. So maybe shoulder 15, low back
Oh
15,
my
neck
goodness.
1,500.
Okay.
Yeah. It's not that, you know, that cheap, you know.
Wow. So it's
Yeah.
almost
So
like
to be
taking
certified.
actuarial exams. There's
Yeah.
1A, 1B.
Yes, in actual, after the seminar, you do have to take examinations based on
Yeah.
what they taught you too. So yeah. So ART, it stands for active release technique. So basically, what it does, because a lot of times that a lot of people use massage therapy a lot, and that's more passive. So when active, meaning movements, right? So you have to understand why active release technique works better than passive, because when we do active, um, you have to understand that we have nerve innervation involvement, we have blood flow involvement, right? So a lot of time, let's say for example, for your shoulder that you were talking about, so there's a lot of scar tissue buildup on top of the muscles, or you know, your overusage, as when we work out our muscle breaks, right, new one's supposed to form, but somehow not enough fluids. Yeah, so then scar tissue buildup, lactic acid buildup. So that's why sometimes you feel like your lateral bicep, you would think it's really muscle, but sometimes you feel there's a lot of lumps there. Those are just scar tissue. So the best way to get rid of those scar tissue buildups is by doing active. So therefore, when you do active for the lateral movements on the biceps here, you're actually having the nerve innervating that and blood flow into that. So as you're doing active movements on that, blood flow comes in, and nerve innervation causing the muscle to contract. So as they contract with movements, it helps washes whatever, scar tissue buildup that, because our body has that ability, okay, to take out junks from the muscles, okay. So by doing that, kind of like we're combing the muscle, kind of like, let's say for example, female, right? You have a lot of hair, so therefore if you just, not combing your hair and just sleep, wake up, sleep, wake up. Imagine trying to comb your hair after 2 weeks, right? It's really hard, right? Yeah. So same thing with muscle. They make out of fibers. So sometimes when you go work out, the old one breaks and new one form, and that's how you get muscular, right? Yeah, so when the scar tissue builds up, the best way is to do active so that you get nerve innervations into the muscle, so it's blood flow into that. So it's a better system of washing away the scar tissue buildup. So that's the best
Saying
way.
nerve interventions?
Nerve innovation. Nerve. Okay,
Nerve,
not intervention. Yeah, nerve innovate.
innovate.
So yeah, innovate. Yeah. So when you talk about nerve, they innovate the muscle to cause it to have that function of contraction. Yeah.
Right.
Yes, correct.
Wow. So
Yeah, so mhm.
go ahead.
Oh yeah, so that's how active release technique it's very powerful. You yourself, that's why sometimes that when I teach you guys, when you guys are my patient, I teach you guys the easiest one to do is the pectoral. As you do bench press, stuff like that, and you guys know that the pectoral is the action contraction is, going forward like this, right? So as you can see, when you go work out a lot, you can see some people walking, hunching over like that. You could tell that's the pectoral that is really tight. So what you could do, that's why people do door stretches. Yeah, you could do door stretches all you want, but that's just stretching it. So when we do active, we hold onto the muscle fiber and then we reinforce the stretching. Okay, along with the with the being active, with the muscle going to their nerve innovations go into there too. Yeah, so therefore, that's why everything works so well with active release technique.
Mm. Yeah, and you're basically moving the muscle in the direction that it's meant to function.
Yes, so we have to moving from a uh shortened position to elongate the contraction. So for the pectoral, for example, its contraction is to adducts the arm right here, and then it's stretching like elongates the muscle is by adducting it. You see, as you can see here, it's stretching it, right?
Yep.
So yeah, so let's say for example, I were to go bench press a lot, and then my muscle gets really tight and it's all bundled. There's a lot of women who feels the scar tissue build up on their chest there, and they get scared because they don't know what it is, because of such a high number of breast cancer. So sometimes I have some patients who comes in and say, oh my gosh, Dr. Yang, I have a lump up here, so I don't know what it is. So they get really scared. So then I would go to that, hey, let me check it out. So if we do active release technique too for to that lumps there, and if it doesn't go away, then maybe you might go check your PCP, so just to follow up. But if I were to do that for you and after the treatment it disappeared, then you don't have to worry about it. Okay. Yeah. So that's how the active release technique is, by getting from the contraction of the muscle fiber, and then by stretching it to elongate it to stretched out, and by putting pressure on that muscle. So therefore, when you do that, we could break that scar tissue a lot easier.
And you can actually feel it start
Yes,
to move.
correct. Yes,
Um,
correct.
so talk a little bit about lactic acid and what that is in your fascia.
Okay, so when we work out, okay, so all these lactic acid is kind of like just the waste and chunk, okay, of breaking up from the from the muscle fiber. So they actually um binds into, because in front on top of the muscles, I don't know if anyone ever dissect cats or whatever it is that in the past or once in their lifetime. So when you dissect cadavers or you dissect any of the animals, there's actually a white fascia that is on top layer of the muscle. So a lot of the lactic acid, they end up building up on top of that too. And so it's the muscle fiber builds up on top of that too. So when it does happen like that, that's why the muscle feels sore, okay? Because of the lactic acid build up on that. And sometimes that is after a workout, you can't really stretch, okay? It's because a lot of these scar tissue built on top of it, and it shortens the muscles into that uh, 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 shorten the length of the muscle for temporarily. So that's why it takes a while for you to like stretch and do all that stuff. Blood flow's going to nerve innervations into the muscle, and after a couple days or so, that's when you could start moving again. Okay, because of that.
So what are the best things that people can do on their own, like in between? 'Cause I know I feel like I need to see you at least once a month, if not,
Mm,
depending on what's going on, 4 to 6
yeah.
weeks. In between, what do you think is the best thing that people can do to help themselves stay mobile
Mm.
and remain active?
Well, basically, I think the best way for very active, person like yourself, each time that before you go exercise, warm up first, warming up to keep all the joints mobile, okay? So that's not stiffed up and lots of fluid. It's easy, simple, but a lot of people don't do that. When
Hmm.
they go work out, they just hop on because that's the easiest things to do, right? Don't require anything, right? But before you do all that stuff, you just kind of like mobilize your joints first, warm up your muscle first, and when you do that, things will flow a lot better in your system. Okay, and it's able to wash off all these lactic acid or scar tissue build up easier. So and stretching, the a lot of things, a lot of people, we don't stretch when we go do something. Even walking, we don't stretch. We think it's so easy, and
Yeah.
then we don't stretch. But if you do that test, if you stretch first and you go walking, I guarantee you next day you're not going to be as sore, okay,
So,
as being just going walking without stretching.
so
Yeah.
static stretching before you go for a walk?
Yeah, you can do any kind of stretch, you know?
Okay.
Yeah, so making sure that do stretch and do some, uh movements with like let's say for example the wrist. You could always bikers, right? Yeah, you guys have to do with range of motions, couple reps or so, before you go, because our joints are meant for movements, right?
Right.
Any time that it doesn't move, it causes pain and discomfort. So prevent you guys from having a lot of scar tissue buildups or lactic acid buildup over time. You guys just need to be more mobile. So
Mobile.
make sure that yeah. So then you guys need to do your stretches, hydrate yourself, and then you guys could go ahead and do your activities. And once that's done, try to stretch again and drink lots of fluids, and that's the way best way is to keep the body hydrated. So when it's needed, the body could just fix itself. Okay. So that's why, so you're so active. That's why I say my job here is to not see you so much, but as needed. Okay.
Right.
Yeah. My job is making sure that you stay active, healthy, and when any time that you kind of hurt yourself, you could come and see me. Once that's done, you keep on stretching, hydrate yourself, do your daily activity. Then you can go on and do whatever that you need to do. You don't need to see me, okay?
Yeah.
Unless you over exertions yourself, okay? Because a lot of times, person like yourself, are very strong, very in good shape. So you guys like to what do you call that term? Like to do more than you should, right? Instead of 20-mile rides, you say, 10 more, because I still feel so good. Let's do 10 more miles on the bike. And
That's a
then after
quick
10,
30.
yeah, yeah.
That's a
Yeah,
fast
yeah.
one.
Yeah. So that's why you overexert. That's all. There's no big deal. So remember, a lot of people, there's no big deal with them. All they need to do is simple stretch, hydrate themselves. They should be okay.
And
A
what do
lot
you,
of time. Yeah, go ahead.
I was gonna say, what do you think about foam rolling and those kinds of things? Are they helpful or not so much?
Yes, they actually better than not doing it,
Okay.
right? Yeah, so when you're doing foam roller, it's very similar to ART. You're putting pressures onto the, muscles, and then you're moving it and it's trying to break those scar tissue buildup. That's basically that. That's what you're trying to do.
Okay.
Okay. And to loosen up the muscle. So it's better doing foam roller stretching than not doing anything at all. Okay.
And what are your thoughts on before or after workout for that on the foam
Uh,
rolling?
I think depends on the person. You could do both. Yeah, because after workout, people gets really tired, they get lazy, they just want to relax, right? So I would prefer after, because when you start working out all that stuff, new muscle, old muscle are breaking, right?
Right.
Yeah. So then some might be landing onto the uh fascia,
Mm-hmm.
or so I think it's maybe better to do it after you work out, so at least this way your body could wash it off, allow it to heal properly, yeah, so you're not
Yeah.
sore the next day. Okay.
Yeah. But before and after is best if you can.
Yeah.
Yeah.
Yes.
But definitely
Yeah.
after.
Yes.
Yes. Okay. Great. Any other tidbits you'd like to share before we jump off?
um like I say, everything is pretty simple. uh Excuse me for a second here. I think your son just texted me. uh, he's lost, so
Oh,
yeah. So okay, which unit? Excuse me for a second, machine
yeah.
here. Let me get him to unit. Okay, let me help him. Yeah. So he's probably here, but let me close this up, so at least this way I could go help him. Well, the
Okay.
the best way, yeah, like we talked about, is very simple to take care of the body. Number one thing is you have to hydrate your body, okay? And any activities, anything like that, it's simple as that. Hydrate yourself and just stretching, if you are very active. Okay.
Okay. Okay.
Yeah, so those are the most simple basic thing that you could do for yourself. And if you do that, and I'm sure that you'll be less sore, you know,
Yeah.
or yeah, you'll be less sore for sure. Okay. So very simple and easy. And if there's any like, you know, problems with joint and stuff like that, you could always stretch the muscle that's surrounding the joints first. And then just to see if that helps. Okay.
All
Any
right.
other questions?
No, I think this was
Okay.
great. I liked hearing your other side of the explanation for acupuncture too. So
Yeah, okay. Maybe that next time we'll do
yeah, there
more
you
of that.
go. There you
And
go.
then we'll catch onto the internal stuff with acupuncture and Chinese, traditional Chinese medicines, or herbal could do. Okay?
Yeah, because we want to talk about cholesterol and
Yes, correct. Diabetes,
hormone health,
hypertension. Yes.
hormone help.
Yes.
That'll be
All
next.
that stuff. Yes.
All right. Well, thanks again for joining in, and thanks for taking care of my son too.
Okay, no problem. Thank you for having me on your Zoom.
Oh, you're
Okay,
welcome.
take
Thanks
care,
for
Michelle.
your time. Bye.